Welcome back to another episode of Board Bitesize. Today we are joined by our Chief Executive Jim Austin and our Chair Julie Holder. We've just finished this month's board meeting and stepped outside to reflect on what has been discussed today in line with our organisational strategy themes of people at the centre, working in partnership, healthy communities and focus on the future.
Well, hello everyone. It's Jim Austin here, and I'm joined by Julie Holder, our chair. And today we're going to give a bit of an update following our October board session that we had in public today. Julie, do you want to make a start?
Yeah, thanks very much, Jim. It's been a good day, hasn't it? Lots of things that we've talked about. So as with many of our reports and discussions, it's almost inevitably the focus is on people, whether that be staff, patients, partners. So today has been absolutely no exception. We began our meeting listening to a staff story, highlighting the emotional impact on our staff of persistent abuse, discrimination and aggression, and the importance of taking early action to intervene and support staff. It really was of concern for us to hear that many staff have internalised this behaviour as being just part of the job. And it's important that no one accepts this, but that incidents are reported so that action can be taken. At the end of that story, I think we were, as a board, really at odds to be able to say, and I want to take this opportunity to say, that bullying, discrimination or inappropriate behaviour will not be tolerated, and we will support people to say no to going into an unsafe environment. And that was a really important message from the board today. As always, the Quality and Professional Standards Report gave us a lot of information and assurance around a whole range of people issues, but particularly around the impacts of potentially restricting funding for Level 7 qualifications and changes in funding for 5 critical roles that are now needed to deliver the 10-year plan. So we've got agreement about those, which are predominantly AHP type roles. I think I've got that right. It was good to hear the feedback from the insight visits to Ilkeston catering team, Chesterfield core team and New Home domestic team. There were lots of common themes there of feedback, which included excellent teamwork, pride and compassion, and innovative ways of working to improve services and better value for money. It would be remiss of me not to conclude this piece around people to not say goodbye to James Riley, a non-executive whose tenure of 9 years was coming to an end, and he's made a really big difference to the board. So I know that as a board, but you and I would want to wish him well.
Very definitely. James made a big contribution and brought a lot of value to us. So we'll be sorry to see him go, and we're in the throes of going through the recruitment exercise for some new non-execs who will hopefully arrive in the near future. So I'm going to move on to healthy communities, and we took the opportunity in public to recognise the CQC inspection of Snowdrop Ward and the great success that had been. And there were some quotes in there around the staff providing person-centred care, compassionate care, involving people and families in care decisions, and people feel safe, respected and supported, with staff maintaining dignity and independence, which was lovely to hear about. And actually care was a bit of a theme throughout the whole of the public board meeting. We also, within health communities, reflected a bit on the care transfer hub. So Dean Wallace, our Chief Operating Officer, has been overseeing with a huge amount of support from people within the trust and beyond the setup of the care transfer hub that will really assist with the winter that we're getting into now. It is October, it feels a bit colder, in helping people get safely and effectively out of acute environments. The care transfer hub has been up and running for a while now, mainly dealing with out of area acute hospital discharges back to residents of Derby and Derbyshire. But this week and last week, it's been going live with Chesterfield Royal Hospital and Derby Hospital. So a really exciting move there. And then finally, for healthy communities, we talked a bit about vaccinations and flu. And just a reminder to everyone that from yesterday, in fact, but from now on, we're getting into the flu campaign, the flu vaccination campaign. As a board, we have the opportunity to get vaccinated next month when we're all together, but really the board completely endorsing and encouraging as many of our staff as possible to take up the opportunity of a free flu vaccination, which would cost you, I think it's £20 in Boots at the moment, or £19 if you were to go and get it privately. So lots of good reasons for getting vaccination. Protects yourself, protects your family, protects our patients. And I think from a team brief last week, we heard that between 80 and 120,000 flu victims were not required to be admitted to hospital as a result of the vaccination campaign last year. As a trust, we have the highest proportion of staff vaccinated of any other provider in Derby and Derbyshire. Really keen to maintain that. So keep your eyes and ears open and please get vaccinated if you can. And then over to you then.
Yeah, and that's brilliant. It was interesting today, wasn't it, Jim, that although we met virtually, there was a lot of us today that were really suffering with coughs and colds. So that season has really started. And so the importance of vaccination is really important. So just to talk about partnerships, there are 3 things from today that really stick out from our discussions. The first is the opening of the Walton Community Diagnostic Centre and the work that's been done there in partnership by Chesterfield Royal, ourselves, funded by NHSE. Great example of working together, creating a purpose-built building that will build a whole range of diagnostic tests that will really help the community there. The second is our visit to the 111 Centre in Derby, and the following day I had the opportunity to visit the centre at Oldbury. My thanks to DHU for hosting me, sitting with health advisors on that day, and it really brought home to me the importance of that first 111 contact and how the triaging is so critical for patients, but also for each constituent part of our system, whether that be pharmacy, dentistry, GPs, UTCs, ambulance or A&E. Finally, your report outlined progress with neighbourhood working. You talked about Families Partnerships Programme, community transformation, and the progress to define neighbourhood hub requirements and priorities for digital download.
Thanks, Julie. And there's quite a lot actually coming out through the comms team around that community transformation programme. So finally, focusing on the future, the 4th pillar of our strategy, we talked about the ICB, the demise of Derby and Derbyshire as it becomes clustered, and we're all part of a 3-system cluster now covering Derby, Derbyshire, Nottinghamshire and Lincolnshire, and how Cathy McLean has been appointed as chair and recently announced Amanda Sullivan as the chief executive. There'll be some further changes coming through that environment. We also talked about the NHS England priorities, and I had my first meeting as part of that cluster with the NHS England regional team, certainly in a cluster formation, first time I've met in that group. Real emphasis on winter resilience, waiting list attention to size and length of time people are on it, and a focus on financial discipline. And actually, as a board, we spent quite a long time, both in public but then later on in private, going through our financial plans for the rest of this financial year, but also attending to what our waiting list look like, what our access targets are looking like. And actually, the board took a great deal of assurance in the work that you are all undertaking to deliver those plans safely and effectively. So I thank you for all of that. It's not going to be any easier, but I think the board is actually completely satisfied that we are doing everything that we can and to a good standard and good quality as well. So thank you for that. And probably that brings it to a close. It was online, which we haven't done for a while, and the meeting rattled through. Julie was very good at sharing it, and I think there'll be an opportunity for some people. You can listen to this little snapshot. You may be able to go back and watch it the whole 2 hours if you want to, but maybe not. This snapshot's probably enough. And if I could just close, and Julie, you'll get the final word, but also just to say, thank you to James Riley. We will be seeing him off in good stead in November, but actually it was a very interesting board for me because the focus on care and people was really right at the top of the agenda. Back to you, Julie, for the final words.
Yeah, it really was a good day. That was definitely the word of the day, wasn't it, today, care. And in as I talked about it as a verb rather than an adjective, the verb caring. But I'd like to say a massive thank you to join you, massive thank you to all staff who are giving us such great assurance about delivery and the difference you're making to patients, residents within Derby and Derbyshire. And we'll be back in December, the next public board.
That's all for today's episode. Board Bitesize will be back after the next public board meeting.